My name is Lauren Sant. I'm the chair of the National Viral Hepatitis Roundtable, or NVHR. And we are a coalition of 150 private, volunteer, and public organizations all working to reduce the incidence, morbidity, and mortality of viral hepatitis. Hepatitis B and C affect about 5 million Americans. It's 3 to 4 times greater than HIV in this country, and unfortunately most of them don't know it. It's estimated about 70% of the people that are walking around with this virus are not currently diagnosed. That's unacceptable. The Center for Disease Control is so grossly underfunded that people are needlessly dying every year because they haven't been identified until it's too late. In 2011, we are going to spend less on hepatitis at the CDC than we did in 2001. This is part of our problem. We need to increase this funding, and it's critical for the people that are living with hepatitis C and B. If we don't have additional resources, more and more people are going to die, and the healthcare costs are going to continue to rise.
I'm proud to be here today to put my face on the disease. And throughout 2009, I was on a robust course of treatment for hepatitis C. I'm pleased to announce today that my therapy is complete. I'm alive, I'm feeling good, I'm strong. I hope that my disclosure last year will provide others suffering from hepatitis with the confidence to speak out and educate the community about this illness. If you have viral hepatitis, you are not alone. It should be clear to everyone who is afflicted with this disease that you don't have to just give up on life. In light of the urgent need, we must devote the will and resources to this problem that it deserves. We need to get caught up to the fact that this is a disease that is becoming more and more prevalent as we speak, and so we need to grab the bull by the horns. Disease respects no socioeconomic status, party, affiliation, or political philosophy. This is a fight that has only just begun, a fight for increased funding and awareness to reach literally millions of people who, without testing and treatment, will die. I'm one of the fortunate ones. I feel, why me? And so that answer is clear, is obvious. I'm here to work for the benefit of humanity, and my face, I hope, will encourage millions of people to gain an understanding and an awareness about this disease. And I want to encourage all of those people who are currently under treatment to take it one day at a time. You know, when it gets so tough and you go home and go to bed and you think, I can't do it again, I hope that you will wake up the next morning and gather your strength and your determination to fight the cold wind blowing against you.
I was invited to take part in a health fair in San Francisco where they were going to do a health fair and do a screening on hepatitis B. I have to tell you, I was a little nervous about the outcome. You know, it's one of those trips that you don't want to take, but you're afraid to hear it, but you're afraid not to hear it. So I was more fearful of not hearing it, and so I followed through with it and found out that, to my relief, I was negative. So now what? That kind of a personal story and experience brought home to me how vivid this could be, because upon receiving my information, another fellow came up to me and says I was diagnosed with Hep B, but it's far advanced. I didn't know. I've got chronic liver problems, and I need a transplant, and if I don't have a transplant, it's going to be fatal for me. And he was desperate for a transplant for that. And so to avoid a lot of that story, which occurs too often, it was evident that we needed to have a movement and a definite policy that we needed to enact here at the national level. So we introduced last year HR 3974, and we have now 30 bipartisan co-sponsors. And taking the information out and engaging people is going to be critical, because doctors need to be educated still, clinicians need to be educated, the general public needs to be educated. And so this is what it's all about. It's investing in prevention and management, and in the long run, it'll save lives.
When I was young, I believe I contracted some form of hepatitis that almost killed me, but I was able to overcome it, and now I'm still around. But the newly released study by the Institute of Medicine reported that African Americans have the highest rate of acute HBV infections in the United States, with the highest rates occurring in the South. I represent the 2nd District of Louisiana, and the district is about 60% African American, and I was concerned by the report's findings that African Americans and Hispanics have a higher rate of the infections than Caucasians. There are limited resources in our states for viral hepatitis awareness, testing, and treatment because of the underfunding. This leaves little to no resources for funding actual services, and there is no funding for community-based organizations to provide services. We were unable to provide hepatitis screenings at my AAA health fairs because of the limited availability of resources, even though there was a great need and request for these services. The IOM report highlights the grave disparity between limited resources and increased cases of viral hepatitis.
It's a problem from hepatitis on a societal level. We all know that now the leading cause of liver transplantation is hepatitis C. One liver transplantation can cost $500,000. One person can blow out the insurance rate for a small group. The hepatitis B immunization programs have been fabulously successful. I'd like to think that one day I will not be getting emails from my nurse or from my nurse practitioner with whom I work because we're out of disease. But that time is yet to come. So this legislation is important. It will continue to define the epidemiology, continue to search for vaccines that are effective for hepatitis C, for cures that are effective for hepatitis B and C, more effective than what we have now, and perhaps even for cures for the prevention of the liver cancer that results from the cirrhosis from hepatitis C.
My name is Andrew Muir, and I'm a hepatologist at Duke University in North Carolina. I have an active clinical practice, and I take care of patients with both hepatitis B and C at all stages of disease. And I've seen firsthand what can happen when hepatitis B and C are left untreated and undetected. It truly astounds patients to find out that one of these viruses has been living in them quietly for years and years, causing so much damage. The patients and their families are left with so many questions. How did it happen? How could it be there for years and I did not feel it? How did I not notice it? Why did my doctors not detect it sooner? The ultimate answer is that hepatitis B and C are very silent for most patients for many years. And if we wait until patients have symptoms, then we have waited way too long. The costs associated with treating these diseases are only going to balloon. The Milliman report estimates that without federal funding, the costs associated with hepatitis C alone will reach $85 billion annually by 2024. I want to emphasize that it doesn't have to be this way. We have a clear public health problem here. The hepatitis community is organized and aligned to address it now. Now we need Washington to act and follow the fine leadership of these distinguished members of Congress that you saw today. I can only hope that more of their colleagues will follow their example. We really cannot afford to wait. With every passing year, I have more and more patients presenting to our clinics with cirrhosis and liver cancer, wondering how this could be. It does not have to be this way, and it should not be this way. And we urge Congress to help to change the future for my future patients.